Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please take a seat. How can I help you today?
Good morning, doctor. It all started about 2 months ago. I've been experiencing some troubling symptoms, and I'm really getting concerned. I first noticed this dull, aching pain in my shoulders and neck. At first, I thought it might be just from bad posture or stress, but the pain's been getting worse. Now, it's spread down to my hips and thighs, and I'm finding it really hard to move around. The stiffness is the worst in the morning. Sometimes, I can barely get out of bed. Even simple tasks like brushing my hair or getting dressed take me forever. It's frustrating, to say the least.
That does sound difficult, Mihiraa. Have you experienced any other symptoms?
Yes, I have. I've also been feeling extremely tired all the time. I used to be quite active, but now, even walking for a few minutes leaves me exhausted. And it's not just fatigue. I feel this general sense of malaise, like I'm always coming down with something. I've had low-grade fevers, especially in the evenings, and I've even noticed some weight loss, although I haven't been trying to lose weight. My appetite has been off as well. I don't feel like eating much these days.
Have you tried any treatments or remedies to alleviate the symptoms, Mihiraa? My appetite has been off as well. I don't feel like eating much these days.
Yes, I've tried a few things. Initially, I thought maybe I just needed rest, so I took it easy for a week, but that didn't help. Then I tried some over-the-counter painkillers like ibuprofen and paracetamol, but they didn't do much either. I even tried some herbal remedies, like turmeric and ginger tea, thinking they might reduce inflammation, but I didn't notice any improvement. I finally went to the pharmacy, and they suggested I try naproxen, but that only gave me temporary relief. I also used a heating pad on my shoulders and hips, which helped a bit with the stiffness, but again, it's only temporary.
I see. Have you been on any long-term medications for other conditions?
Yes, I have a bit of a history of hypertension, so I've been taking amlodipine for about 3 years now. My blood pressure has been fairly stable, but I check it regularly at home. I haven't had any issues with it lately, though. Besides that, I've been on a low-dose aspirin for heart health, which my previous doctor recommended, especially with my family history of cardiovascular problems.
Speaking of family history, is there anything else relevant we should know, Mihiraa?
Well, both my parents had some chronic conditions. My mother had rheumatoid arthritis, and my father had heart disease.
It's good that you mentioned your family history. Based on what you've described, I'm leaning towards a diagnosis of polymyalgia rheumatica. It's an inflammatory condition that causes muscle pain and stiffness, especially in the shoulders, hips, and neck, just as you've mentioned.
I've never heard of that before. What causes it?
It's an autoimmune condition, Mihiraa. Well, we'll need to do some tests to confirm this diagnosis. I'll order blood tests, including your erythrocyte sedimentation rate and C-reactive protein levels, which are markers of inflammation in the body. I'd also like to check your liver and kidney function to ensure everything's in order.
Okay, that sounds reasonable. What's the treatment of the condition?
The first-line treatment usually involves a corticosteroid, such as prednisone. It works by reducing the inflammation, and patients often experience significant improvement in symptoms within a few days of starting treatment. The dosage will likely start high and then gradually decrease over time as we monitor your response and the inflammation levels. Depending on how you respond, we might also look at other tests like an ultrasound of your arteries to rule out giant cell arteritis.
Okay, thank you, doctor. I feel a bit more hopeful now.
You're welcome, Mihiraa.
Extract 2. Questions 13 to 24. You hear a physiotherapist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How are you feeling today? What brings you in?
Good morning, William. Well, I'm not really sure where to begin. It's my knee. My right knee, specifically. I've been having this discomfort for a while now, and I'm concerned it might be something more serious than just a sprain or something like that.
Okay, I see. Can you tell me a bit more about this discomfort?
Sure, so I first noticed it about, maybe 5 or 6 months ago. It wasn't too bad initially, just this dull ache after I'd go for my evening walks. I didn't think much of it, but then the pain became more persistent.
That must be frustrating, Mihiraa. Have you noticed any swelling or stiffness, maybe in the mornings or after periods of inactivity?
Oh, absolutely. There's definitely some swelling, especially if I've been on my feet for a long time. But what really worries me is the stiffness. It's like after I sit for an hour or so, my knee locks up. And when I try to straighten it, there's this grinding sensation, almost like something's stuck in there. Sometimes I even hear this popping sound when I try to move it. It's been progressively getting worse, I think. At first, I thought it might be just normal wear and tear, but now I'm not so sure.
Those could be signs of some underlying joint or ligament issue. Have you had any recent injuries?
No, not really. I mean, I don't recall any specific injury. But, when I was younger, I did a lot of running and sports, so maybe that's catching up to me now. Oh, and I've also noticed that my knee looks a bit misaligned. I don't know if that's relevant, but when I stand, my knee kind of points inward. It's not straight, which is strange because I never noticed that before.
I'm glad you mentioned that, Mihiraa. From what you're describing, it sounds like there could be a case of genu valgum. It's when the knees angle in and touch each other when the legs are straightened. That might explain the misalignment and the additional pressure on your knee joint.
Oh, I've never heard of that before.
May I ask about your current weight and height? Sometimes excess pressure on the knee due to weight can make these symptoms worse.
Yes, of course. I'm around 78 kilograms, and I'm 162 centimeters tall.
All right, have you tried any treatments?
Yes, actually. I've tried a few things. I've been using non-prescription anti-inflammatory medications, but they don't seem to help much. I've also been using ice packs after long walks, but the relief is temporary at best. A friend recommended some knee braces, so I've been wearing those, but honestly, they're not very comfortable, and I'm not sure they're doing much to help.
So it sounds like you've tried several conservative treatments without much relief. Have you done any physical therapy or specific exercises?
Well, no. I mean, I've tried some light stretches on my own, but nothing too intense.
I understand, Mihiraa, but in cases like yours, strengthening the muscles, especially around the quadriceps and hamstrings, is crucial. It helps support the knee joint and can relieve some of that instability you've been feeling. I'd also recommend some low-impact activities to avoid stressing the joint further. Let's focus on a combination of targeted physiotherapy exercises, and if needed, I might refer you for further imaging to assess the joint more clearly. We can also look into some custom orthotics to help correct the alignment while walking. If, after a few months, there's no improvement, or if your condition worsens, we we can discuss other options like surgery. But for now, let's focus on the non-invasive treatments. Does that sound like a plan?
Yes, thank you for explaining that.
I'm optimistic we can improve your symptoms, Mihiraa.
That is the end of Part A.